Hello everyone. Are you thinking about getting the latest design inked on your body in the form of a tattoo? So before you do so, please make sure that you watch this video. I'm Dr. Sahana, a dermatologist practicing in Bangalore, and as dermatologists we see a lot of tattoo related complications which the general public is not aware of. So today I'm here to discuss a few of the tattoo related complications and what we can do to prevent it. So there are mainly three types of tattoo reactions. The most common one is something called an inflammatory tattoo reaction. The second one that we see is an infectious type of reaction, and the third one, or very rarely, we also do see malignancies or neoplastic changes in the tattoos. So the most common one, which is the inflammatory type of tattoo reaction, so this usually is a type of allergic contact dermatitis to the dyes which are used. So other than including black pigment, a lot of the colored dyes, for example, red is the most common pigment which can cause an allergic tattoo reaction, has a compound called as cadmium red. In the same way, yellow has a chemical called as chrome yellow. So the other pigments as well have a lot of these heavy metals which can incite an allergic reaction to your in your body. So the second type of reaction that we see, the infectious. So it can be any type of an infection. It can be a bacterial infection, it can be a viral infection or a fungal infection. This happens when these infectious material are getting inoculated through the needle and they actually penetrate our skin. And the third one, the very rare one, the neoplastic change can also happen sometimes because these inks also contain some carcinogenic material, and if you're getting inked over a larger surface area of your body, that can lead to a chronic long-term malignant transformation. So what do we have to know before getting a tattoo is always go to a place which is trusted. And even the roadside places that you see, even the henna tattoos also have this chemical called as PPD, which is the same chemical which is found in our dyes which can cause these type of reactions. So always go to a trusted parlor where you see the tattoo artist actually take out a new needle, and also make sure you check the expiry of the ink. So it is not only the needle, but most of these pathogens, the bacteria and the fungus, are actually present in the ink bottle. So make sure you check the expiry of the ink, and as far as possible just stick to black pigment. Avoid any type of color because most of the reactions that we see are usually because of the extra colors of the dyes which are used. So how do we actually treat once a patient comes to us with a tattoo reaction? So a skin biopsy is the only way which can actually differentiate what is going on inside, whether it is an inflammation or it is an infection or it is a malignant change. So the first step that we do is take a small piece of the skin and send it to the pathology for a histopathological examination. And once we get the results of the biopsy back, we treat it accordingly. Like the inflammatory processes can be treated with simple topical corticosteroid creams and anti-inflammatories, whereas the infectious, depending on the type of infection, has to be treated with antibiotics or antivirals or antifungals, and the very rare malignant change has to be treated with chemotherapy, but again that is a very rare complication. And once we treat the inflammation or the infection, the next thing that we usually do is remove the tattoo entirely. So we have lasers for this purpose. The most common one that we use is something called a Q-switched Nd:YAG laser. So removal of a tattoo takes multiple sessions. So I hope all of you watch this video and keep all these points in your mind before getting your next tattoo. Thank you.